Can honey help treat allergies? Could it cure them? I was recently asked a series of questions by a reporter about this. Let's talk about it. Hey, everybody, it's Dr. David. So, as you know, I've been getting a lot more questions by reporters, and they're asking me more detailed, multi-part questions. And a recent inquisition came through about the use of honey for allergies. Now, there's a lot to this because people can just take honey as obviously a sweetener. People can take raw honey for all the different ingredients in it, propolis, royal jelly, etc. And then there's also what people are doing called oral honey that's using raw local honey that's seasonal. So the first question that was asked was, does local sourced honey help with allergies? Why or why not? Now, first of all, it must be said there's been very little research that's been done on this whatsoever. I certainly it's something that I do have clinical experience with, but it is mostly anecdotal. But if you do a literature search, as I did preparing for this, there really isn't much out there in terms of good evidence about this. You'll find stuff about local honey, but I really don't see anything about raw and unprocessed, which we'll talk about in a bit as to why that is important too. But the idea of this whole thing is that the bees go out into the community where a person lives, and then it pollinates, brings that pollen back to the hive. When it makes honey, it puts a small amount of that honey into a small amount of the pollen, I meant to say, into the honey, which then is given in obviously taken into the person who is consuming it. Now, this kind of works for a couple of different potential reasons. First of all, it may actually have nothing to do with the actual pollen that's in there, because raw honey, unprocessed honey, propolis is an anti-allergy, anti-inflammatory agent. So while people are taking it for this desensitization, that may not be why it's working at all, but yet it still could potentially work. But first of all, the reason why the honey, in order for this to potentially work, needs to be unprocessed or raw is because the allergens themselves, the pollen, could actually be destroyed if it's cooked. Okay, so then you don't want to destroy it because then that would decrease it. So, but similar to when a person takes allergy shots, or if a person does sublingual immunotherapy where they put drops under their tongue, what is happening here is that in both of those, similar to the honey, they are taking very, very minute amounts of the thing that a person is allergic to, and then it does a desensitization over time, where the immune system is taught over time to no longer create histamines as a response to the exposure, and if there's not histamine released, then the wheezing or the snotty nose, the eyes, the burning, all of that won't take place. So it's really kind of a desensitization. It's modifying the immune system, which is pretty neat. Now, as far as the honey goes, of course, it would only be potentially working if the bees were pollinating the thing that the person was allergic to, right? So there may be some things like certain trees that don't really pollinate much at all that they would be doing, but a person could still potentially be allergic to them, and that probably wouldn't make that much of a difference. So again, it could be the propolis that's doing it, but it may not be doing that. But of course, if there are any food allergies, or if there are any indoor allergens like molds or cats or dogs, that wouldn't help really in terms of the desensitization process if a person was doing the raw honey. Now, it's also very important that a person does honey in a seasonal way. Okay, so certain plants obviously come out, they bloom at certain times of the year. So if a person says, "Hey, my allergies are worse in the spring," you'd want to use something that is both raw, that's local to that environment, but also that the honey was harvested during that same season. So typically, the beekeepers will make honey for one season during the time when the bees are pollinating that, but they don't use that batch until the next season when a person is starting to get exposed during their particular allergy season, if that's what happens there. Now, another question that was asked is, can my child safely use honey for allergies? Now, assuming that a person is not allergic to honey, which is rare, but we've seen it happen before, Children over 1 year old can safely consume honey. Now, consumption of honey prior to 1 year of age could potentially be an issue, and there have been a few cases reported where the honey is contaminated by botulism, Clostridia botulinum. And that can be a problem because that can cause paralysis. That's like botulinum toxin can cause that. Now, it is felt that after a child is over a year of age, that their intestinal immune system is strong enough to be able to fight off the spores from this particular Clostridia, that it really shouldn't be a problem for almost anybody after 1 year. But that's where that don't consume honey for less, if you're under a year, can happen. It can happen with processed honey too, although less likely because of the way they ultra pasteurize it and all that kind of stuff. But still, that's something to do. And the other thing that would be concerning would be if a person had diabetes because of the sugar, because although it is felt to be a healthier, it's still sugar. It'll still throw a person's sugar levels up. A person who doesn't handle sugar because they have diabetes, then they could potentially be causing instability and causing increased hyperglycemia. Now, what are the guidelines for using honey to treat allergies, including age requirements, amounts, and other things to look for? So this is the protocol that we have been using at Holistic Pediatrics and Family Care. We recommend starting off with a quarter of a teaspoon of the raw seasonal honey, local, and increasing by a quarter teaspoon every 2 days, working up to about 1 tablespoon per 50 pounds of weight for that person. So if a person was weighing 100 pounds, we would work them up to even 2 tablespoons. Now, it's something that we recommend that if a person knows what their season is, that you start it a couple weeks before the allergy season starts, so you can kind of work up it and continue until their allergy season is over. Now, in addition to that, we really encourage people just, to keep on using it. But if it doesn't work, it's maybe just time to move on to something else as well. So it's not really based upon age as much as it is what a person's weight is. For parents who want to use honey as a homeopathic allergy treatment, what do you recommend? First of all, I did point out to this reporter, this is not a homeopathic remedy. Okay, homeopathy works on the theory that the more diluted it is, the stronger it is. But the strongest of the remedies, you can't even measure any actual allergen that's within it, and that's different because you can clearly measure it. And of course, we're increasing the amount that a person is taking over time. So, it's working in a similar way that it's a dilutional effect, but it is a misunderstanding if you're thinking that it is a true homeopathic remedy. So that's something that I really wanted to point out there. And then the other thing is, what else do you think parents need to know about this approach to allergy treatment? So first of all, as long as it's gotten from a reputable beekeeper, that it is a safe thing to do for anybody over a year of age. And while it may work, it may not work, but it is a safe thing to try. So if you're looking for something natural, again, maybe it's not the desensitization, it's the propolis, and again, you won't know if you do it. But if it works, it works. And if you don't want to put your kid on allergy medicines, or for yourself, if that matter, then this could be a viable option. Now, I would say that if a person is taking an allergy medicine, that a person not stop the allergy medicine until they've worked up to the full dose of the honey and they're there for a couple weeks. With allergy medicines, especially antihistamines, they kind of work on spot, right? They're there for the day. So after a person's been on the honey for a while, they can just stop taking it, and then they can see what happens. And of course, if allergy symptoms come back, then that answers that question real fast. Of course, it's always best for a family, for a person, to be consulting with their local healthcare provider for anything relative to their allergies. But of course, I realize not everybody does that, and here's some information that may help you too. So I hope that gave you some information that you didn't know before and that it's helpful. And of course, if you know anybody with allergies who may suffer this way, please share this with them. And of course, as I always say, please join us and subscribe to us, hit up our notifications, and join us on our other social platforms and become a Patreon member, where you can see all of our holistic remedies and treatment protocols right there and then. Have a great day. If you like what you've seen, see that subscribe button there? Please click it and turn it from red to gray.